Hey, welcome guys. So this is a little bit different than what I normally post about. Video is going to be about a surgery I'm having tomorrow, septoplasty surgery. So I have a deviated septum in my nose and my turbinates are big and the doctor needs to pretty much chisel away. I don't know what's going on. But it's called septoplasty, and if you're reading this then you probably know what it is and you're looking as I was trying to find videos on YouTube. I really didn't find anything that really was letting me know what was really going on or how it would feel. It seems like a difficult surgery, and actually a lot of people are scared to have it. So I'm making this video to make it a little easier for people, to show them, people like me, that doctors are also here to help you. So I have a breathing issue. I can't breathe that well through my nose. I maybe get 30 to 40% air coming through my nostrils, and the average person probably gets 95%, so I'm well below the average. So I really don't get as much oxygen as you get, and I've had this problem since I was a kid, so I really didn't even know anything was wrong until I went to get an MRI about my sinuses, and they told me, like, okay, you might need to have this surgery. We might have to reduce your turbinates, and I also have a very rare or some type of other nasal valve restriction. I really don't know the name of it, but septoplasty, turbinate reduction surgery tomorrow. So for those of you who are having this surgery, I never had this, but from my understanding on YouTube, it's best to get some things pre-surgery to make yourself as comfortable as possible. As you guys can see, I got a refrigerator right here. It has everything in it that I'm going to need. I have bottled waters, and it's full of popsicles, you guys. So the popsicle I'm going to prefer is going to be icy pull-up type popsicles, but it can be whatever you guys want. I'm sure you can hear the congestion in the way I talk, and that's another thing. Like, I'm just always congested, and it turns out I have big turbinates. But so I'm going to be I won't be able to breathe through my mouth for a few days. Everybody varies. Everybody is different. So you really don't. Nose. I'm sorry. I won't be able to breathe out my nose for a few days. Everybody is different. Some people might go 7 days without breathing out their nose. Some people might. Well, the stents. I didn't explain about the stents either. They're going to put these big stents in my nose and sew them in to keep them. They like going to go all the way up here. But hey, we're going to get through this, you guys. So your mouth is going to be dry from breathing through your mouth. So I have different ones to keep my mouth. I always go overboard, you guys. Here, let me show this. So this is what I have. I have the gum, the dry mouth gum. I have the oral rinse. I have the moisturizing spray. And I also have the moisturizing gel. My mouth will not be dry, because you're going to be breathing out your mouth for days, so you're going to have that dry mouth. So I got some of these things. Also,
can I say something about that?
What?
These three come in a pack on Amazon for about $20, and that is like $5. So that's biotin, moisturizing spray, biotin oral rinse, and then the gel. Sorry, but that way you guys can know where to get it and about the price range.
Also got this on Amazon. It was about $18 for the 3-pack. That's a lot cheaper than going to stores. These things are like $10 a piece in the store I was going to. I don't know where you go. But the saline to rinse the nose out, got that. Also got peroxide and Q-tips. Very important to clean under for the crust and stuff so it doesn't crust out, to make it much easier to pull the stents out. Also, I have nasal gel just in case my nose gets dry. I have some nasal gel and spray, both for moisturizing the nose. Have some Afrin because I guess I'm going to have to use this for a couple of days. Also, I have a whole boxes of tissue, and I have some things that connect around so the tape doesn't irritate my nose. We're at 4 minutes. That's cool. So the tape doesn't irritate my face.
You have time to get that stuff to show them that too?
What?
Your
the
place,
might
the
as well.
bandage.
Hold on, you guys. Might as well.
Yeah.
Oh, Also, I have my neck pillow.
A boppy pillow.
I'm ready for the neck pillow. Okay, so I have tissue, and I also got these off Amazon. So they were like $25 a piece, but we found them for like a whole box for $10. So I definitely recommend that. You don't have to spend $25 for this, because the one I was going to get was $25, and she was like, wait a minute. You know, so then the nurse came in handy. I'm so lucky and blessed to be able to have a nurse to take care of me in this situation, you know. But so I don't think this, she does not recommend this, but this is what I made with I have these gauze, and I just wrap them up in a tissue, and I'm going to put them over my face like this. I also have a face mask. So this is the this is the face mask that I'm gonna use, the ice pack face mask that I'm gonna use. I also have this one. You wanna say something, Mom?
Yeah, you're supposed to only keep it in there for 30 minutes and not let it to freeze like this.
Oh, it ain't supposed to freeze like that? So
no.
Let's just leave it out there.
Yeah. You're messed it up.
It's only supposed to freeze for 30 minutes.
That's it. Hey, you putting the cart before the horse, that's all.
Where the fuck is that?
I don't know. They're only supposed to be in there for 30 minutes at a time. Read the instructions, people. Reading is fundamental.
So it ain't supposed to be frozen like that?
No.
Did I mess them up?
I hope not. They said only 30 minutes.
All right, I got to get those up. All my popsicles failed. Matter of fact, let me get one now while I'm talking to y'all. So, yeah. So I guess tomorrow I'm going to do a day 2. Well, day 1 of the surgery. So my surgery is at 6 o'clock in the morning. And right now it's about, what, 5 o'clock, 4 o'clock? What time is it, Mama?
Alexa,
watch.
What time? Oh, okay. It's 4:45.
So it's 4:45 the previous day. So we are about 13 to 14 hours pre-op right now. So I'm nervous as heck, but I'll catch you guys tomorrow. I just want to show you guys what I'm using and the things that I have to make myself more comfortable for this surgery. So tomorrow I will talk to you guys when I'm on the way there, maybe, and a little bit before the surgery, and then right after the surgery, and then how I'm feeling for the next 5 to 6 days after the surgery. So this is going to be a nice long video, maybe 30 to 35 minutes. So I hope you guys enjoy, and hopefully I can help you get through this. I also have anxiety, and I'm like worried about stuff, so maybe I can help someone like me. So that's why I'm making this video, and we'll see you guys tomorrow. All right, you guys, I am headed to the surgery building.
In a quarter mile, turn right.
I am very nervous at the moment, but you know, hopefully that'll subside. My anxiety is kind of rough right now because I don't know what to expect. You know, not breathing out my nose is really bothering me. I'm pretty sure my blood pressure is high. So we'll just see how I feel after surgery, but I have made it. Hey you guys, so I am now in the room preparing for my surgery. I am nervous as heck. The doctor's about to come in. We're just chilling right now, just waiting to get my IV, and then I'm going to go in and get prepped for the surgery. So next time I see you guys, I'll be out of it, and I really don't know how I'm gonna feel. So just wish me luck. Man, I'm so nervous, you guys, but we're gonna do it. I'm gonna go ahead and go with it. You know, I got everything prepped at home ready for me. The doctor's about to come in. Cracking. But I want to show you guys how my nose sounds. So listen to this. This is one side of the nose. Let me fix this. Sorry, you guys. Here's one side, and here's the other. So that's how it sounds, right? And I've been living like this. So hopefully that goes away. So we're here, about to get it done. See you guys after the surgery. Okay, guys, so I'm trying to eat my first meal. I got my shake. And like I said, I can actually breathe through my nose as of right now, but I'm sure that's gonna stop. But as of right now, I can breathe through my nose, and I think the Percocets are kicking in. So the pain that I was feeling in my nose is leaving. I would have gave it maybe a, excuse me for talking with my mouth full, you guys. I would have gave it maybe a 3 to 4 pain level. My nose wasn't really bleeding like that. But I'm just gonna stay rested today. I'm not gonna do anything. And let's just hope that I can get over this. But so far so good, you guys. Talk to you in a minute. I'm going to keep you updated and let you know exactly how I'm feeling at the time for those with anxiety like I have. But so far so good. I can breathe through my nose as of right now. But talk to you guys in a minute after I get home and get propped up. So far so good, you guys. Thank you for the support. Hey, you guys, so now I'm home, and so far so good. What I noticed is, so I can breathe a little bit. I'm sure that's not going to last for long. Once the swelling starts, it's probably going to completely shut, so I'm just preparing for that. Not as bad as I thought it was. I can feel the splints. It's more of an uncomfortability than a pain. Like, I can feel them. But let's just see how this goes. I don't know. I guess I'll talk to you guys in a few hours. So, you know, I don't know. Maybe sometime tonight I'll do another video. I'm going to rest a little bit, but I'm going to do another video soon. And keep you up, guys, updated on when the breathing stopped, when my nose swelled up to the point where I couldn't breathe, or so far so good, or, you know, excessive bleeding, just different things that I feel. I'm going to let you guys know. All right, so thank you for your journey with me. The time has started. We're here, we're doing it. All right, so I'll talk to you guys in a minute. Turbinate surgery finished. Holla. All right, you guys, so we are about 6 hours post-op. I feel great. I can still breathe. I can still breathe through my nose as of right now, but I'm pretty sure that's going to change soon. I just did my first nasal wash. Actually feels a little better, less congested, and that's just with one. So I'm sure if I do this 4 or 5 times out the day, I'm going to feel a lot better. So so far so good. My anxiety hasn't really pushed me over the edge yet. I am at least a little easily irritated because my face is so swollen. Any type of pressure on it, like if it just hurts, it hurts to have this on it. Like any type of pressure on the face, it hurts like heck. So just as I'm talking to you, I can feel like the pressure in my face. It's I don't know how to explain it. It's just the smallest amount of pressure stings like a mug. So, you know, I have the little just baby ice pack on. I think I'm gonna have to switch to the other ice pack because I don't think this is cold enough. So I'm going to switch to the other ice pack, and I'll let you guys know again tonight. Let's just see if it stops up. So I'm just giving you guys an update on how I feel right now. So far, so good. I'm excited I had the surgery. It's nowhere near what I thought it would be. I was like so scared of this, but it's really not that bad, you know. Only because I can breathe a little bit through my nose, but I'm sure that's going to stop. Let's see how I feel when I have no circulation in the nose. So, hey, we're still here though, you guys. I will talk to you guys in a minute. I'm going to go ahead and change this and try to get a colder one, and we'll see how that goes. All right, talk to you in a minute. Hey, you guys, so I am about 9 to 10 hours post-op now. As you can see, there's a little bit of breathing. Let me turn this down for you guys. Look at that. He just threw up in his mouth. Watching a zombie movie. So I'm about 10 hours pre-op. As you can see, I can breathe a little congested, but hey, at least there's some breathing. Day one went okay. I am actually eating a solid food. I wasn't expect to. Sean made me some chili
yesterday, and I plan on eating this chili for the next few days. Everything is going good. Got my neti pot. I've been using it. I'll show you guys how I use that in the next video. So when I come back, it'll be using the neti pot. But so far, so good. No anxiety, no panic attacks. Actually taking it like a G. It is extremely uncomfortable. I do not like this. My nose is fat. I can't feel my face. Highly congested, but hey, we're dealing with it. Day 1 is going smoothly, but I'm only really worried about day 2 and day 3 and maybe day 4. So we'll see how things go, man. Talk to you guys in a minute as I start rinsing my nose out. Hola, good morning, swaggers. Man, so it's been a very, very frustrating night. I didn't get any sleep on the first night, so we're about 24 hours post-op now. Well, a little under 24 hours, maybe like 20, 21, 22 hours. Been a long journey already. I didn't get much sleep. I went to bed I got about 3 hours of sleep last night. I was up all night. I didn't get much sleep. I can breathe through my nose a little. Just a little bit. That's what it sounds like. Just a lot of mucus and blood. I guess just super congested. So I think I like the worst congestion cold you've had, and that's probably it. But still not as bad as I expected it to be. I mean, the way people were talking on their vlogs was just like, they were like going crazy. You know, I took the bandage off yesterday. The bleeding stopped. Now it's just dripping mucus and stuff every now and then. Did about 8 rinses yesterday. I'm gonna do about 8 to 9 a day. I'm about to do a rinse again. I was supposed to show you guys and I kind of slipped my mind, but I'll make sure I do it today on day 2. But so far, day 2 is going pretty good. I'm just gonna watch me some TV. I really don't, I'll probably eat me some cream of wheat or something. But so far, so good, people. I had some chili yesterday. Been eating my snacks and stuff, so my appetite is still there. So far, so good. Like I said, it's not as hard as I thought it would be. People made it sound so rough. If you really want to get the surgery and you need it, get it. Like, don't be like me. I really almost canceled, you guys. But I didn't, and I can breathe out of both nostrils. Little bit, very little. But it's not 100% stopped up, so that's good. So, we'll see. The doctor wants to take these out on Monday, but I'm going to ask him if I can go until Wednesday. So he want to take them out in 4 days instead of 7, but I'm going to ask if I can leave them in for at least 6 to give the swelling time to go down, and so it doesn't be so bad when he pulls them out. But if he say that it's not going to matter, then okay, I'll get them out Monday. Today is Friday, the 30th. Supposed to get these out on Monday, but we'll see. So far so good, no anxiety really, no, well, yesterday was the panics. Today I've been good. I probably got another couple of days left. Oh, she's here. Huh? But yeah, so Shine just walked in, let her get some rest. I've been up all night and stuff. So I'll talk to you guys in a minute. I'll let you know more. 22 to 24 hour a day in. Everything's doing good. Talk to you guys in a minute. What up, though? What up, though? So I told you guys I was going to show you how I use, excuse the footage. But I was going to tell you how I clean my nose, right? So I don't know how you guys want to do this. When you guys do it, they really, you could just use this, but I go overboard everything. Because I'm having my stents taken out in 4 days instead of 7, so I'm cleaning my nose like 8 to 10 times. I've already probably cleaned my nose 10 or 11 times since surgery, and we are about what time is it?
It's 10:02.
10:02. Can't no music be playing. They go. You got the music. Yeah. They go. They do that copyright stuff.
I didn't know you could hear.
Yeah. But anyway, so yeah. So this is what I do. So first, I saline the nose first, right? Then I do a bottle of this, and then I do my lavage, right? So that's how I clean my nose, and it has been cleaning it perfectly. Like I've almost gotten all blood out. So I'm going to show you guys how I do it right now. Can you see?
Yeah, and let them know that those Excuse your footies. Those footies was about to make you feel better.
So these right here. Let's clean off that blood on it. So this is what I use first, right? So you guys can watch me. It's just a little mist that comes out like that. They got on you. So this is the mist that comes out, and I hold it, tilt my head, and I get all around to loosen up all that stuff in my nose. Oh shit, I forgot. Okay, there we go. Excuse my language, y'all. I don't know if you guys can see my stent under there. Can you see it?
Let me see. Just be still.
Oh.
It's like right there. I'm not sure if you guys can see it.
If you saw it on there, they saw it. So here's the second dose. As you see, no blood's really coming out because I have been keeping this thing super clean. Nothing. So that's the first round that I do. Well, there's a little bit of blood, but I'm telling you guys, I clean my nose extensively.
This is 24 hours after surgery.
Yeah.
You're doing really well.
Okay, so the next one is, one second, let me grab it. Hold on.
Camera lady.
It comes with a salt packet. It comes with the salt packet. So what we're gonna do is,
What is it?
oh, did I explain it?
No.
It's the neti sinus rinse. This is what they give you to clean your nose. Now this is what you're supposed to, really you can just use this and that's all. You don't really need all that stuff. You just need that and that's it. But like I said, I'm extra with stuff. So that's just how I am. So first we're going to fill this up with water. Now make sure you either use distilled water. Make sure you use distilled water or a water bottle to do this. Don't use faucet water. So either distilled or bottled water or boiled water. I really hate this, y'all, but I really got to do it. So what you do is you take the pack that it comes with and you pour it in.
You fill it up to the line?
Yeah. Well, you know, they should know that. Yeah, you fill it up to the line. They should know that. I shouldn't tell them everything. But yeah, you put this in, you know, just like that. I put the top on, and I just give it a little shake. And what I do is I put my head over and watch it come out one side and go to the other. Maybe I should do it on this side so we could. Can you see?
I can see fine. You want?
And that really gets the blood out. Did I go to the other side?
Oh, God.
Oh, shit.
Okay.
Sorry. You see that one? Ouch. That was too hard. I hit my nose way too hard. That is so uncomfortable, you guys. I'm not even gonna lie to you and tell you that it's comfortable. It's not. But it really works. All right, so now for the final finale is my Navage. So what I do is I fill it to the line. It's a line right here. I put my salt pack in. And listen to that. I've been cleaning so much I actually have air coming through. I'm not, and this is the second day. I'm not just breathing straight through my nose. Earlier it was, but now I can breathe because I continuously do this. I'm not saying it's perfect, you guys, but it's better than nothing. Oh my God, it's so better than nothing. So I close it, just like this. I actually have a video on this, you guys. It's a nasal cleaner. It sucks out the stuff in your nose and puts it down here. I'm going to show you guys now. All right, watch.
No, turn the other way. There you go. Yeah, that's better.
So I do a little bit in one nose. My nose is so clean.
And then I do it other way, another way to the other nose. Now this nose is a little bit harder to come out of, but it's coming back. You see it's going a little slower. So that's my swollen side I can see. I'll turn it back around to the other side, and now I'm doing the left nose. And then this is all the stuff that was in my nose. It's much better, you guys. It's much better. This was completely red. Was it not?
Yeah.
It was completely red with clots and blood all in it. But the more I do it, now it's no blood, it's clear. Now there is stuff that's in my nose, but it's not like it was yesterday. And I'm just going to continuously
Hold it up closer to the light to see if they can see the particles that in the body. Yeah, that's better. Yeah, no, they couldn't see that first. That's way better to see. Yeah.
But it was red, you guys. Here, I'll pour it to the sink so you guys can get it. It's not really that bad. It was super red yesterday. And this morning when I woke up, it was super red. But like I said, this is already my second time doing this. It's only 10 o'clock. What time is it? Mm-hmm. It's only 10 o'clock. And this is already my second time doing this. So I normally try to do it at least every hour to two. I'll do it. There really is no thin line between. Thank you so much, man. There was really no thin line between how long and how much you can do it. But that's what I do, and it's been working for me. And we're at like 20, well, a little over 24 hours now. Well, yeah, 26 hours, 26, 27 hours post-op. And I'm already breathing through my nose. Now, it's not perfect, and I'm still breathing through my mouth because I'm not getting enough air through my nose, so I'm still mouth breathing, but at least there's some comfort there in air, and it's not just completely stopped. But, all right, guys, see you guys in a minute. We'll talk. Hola! So, let me talk to you guys about what I've been going through since day 3. Let me fix my thing. It's overexposed. There we go. So, you know, it's been a tough road, but it's really not been that bad. I honestly feel like I'm breathing better right now with the stents in than I ever have in my life. Now, well, I can breathe out of both noses. Listen. Now, there is congestion there, of course, but I can breathe, you guys. I can breathe. Like, when I woke up, my girlfriend said that she was like, you were sleeping so peacefully with your mouth closed and I didn't hear anything. There was just breathing. I was like, wow, you know, so it actually worked, you guys. So if you're thinking about having a surgery and you were scared like me, I say, don't worry about it. Just force yourself to do it. So far, so good. I won't know until the splits come out. Monday, which is 2 days from now. Today's Saturday. I had the procedure done Thursday. The splints come out Monday. So I had to go 4 days with the splints. I actually want to go longer because I think it's going to be so sore pulling those things out. But, you know, we're just going to handle it. Everything is going, you know, I slept good last night. I went to bed about 11. I woke up about 6 in the morning. So, I got like 6 or 7 hours of sleep, which is great. You know, I didn't sleep at all the first night, you know, so getting 6 or 7 hours the next night was pretty good. And then I woke up, my face was really tender and hurting. I had to take a pain pill. I say it was a pain tolerance of about 6 or 7. It was hurting. My face feels like it's you know, getting better, but still swollen, you know, but it's just a lot of pressure around my eyes and nose right here. The tip of my nose is extremely tender. Yeah, tender right here. Yeah, real tender, but at least I can touch it. I couldn't touch it yesterday or the day before. So I think, you know, so far so good. You know, we at day 3, we'll see how things progress. I'm gonna eat some breakfast and watch some movies with my girl, and we'll see. I guess I'll be back later to tell you how day 3 went. Yeah, day 3. All right, you guys, see you in a minute. Hey, everybody, I'm hanging in there. So, it is now about, I don't know what time it is. Alexa, what time is it?
Like in a book or a play or a film, but not digital, not on a memory.
All right, so it's 5:30 on day 4. So I'm trying to think of how this day has went. It's been probably the worst day for me as far as stuffiness. I haven't really been able to breathe all day. This is what I have right now. There's like really not too much air going through it. You know, it's like 1 minute it's fine and the next minute it's not. So, you know, kind of going through those stages right now. But as of right now, I don't really have too much air coming out of it. You know, get the stents pulled out tomorrow. I'll see if I get any sleep tonight. This has really been just the most stressful day of all the days for me. This has been, I don't know why, but all day I've just been feeling groggy and stuffed up and just all puffy, you know. I haven't really felt like that too much until today. So let's just hopefully it goes away after today. It gets better after these stents come out tomorrow. Oh, excuse me, you guys. I'm so sorry. That's about it. I really don't know what to say. I'm trying not to speak a lot. Really having difficulties with the breathing. So I guess I'll just chat with you guys either later on tonight to see if I get some rest tonight, or I'll, you know, in the morning I'll do something in the morning, do another video. But hopefully these videos are helping you guys get through it, you know, if you need the surgery done. So I can't even really think, you guys. I'm so sorry. I can't really think. I'm just like all the way messed up. So I'll just chat with you guys in a minute, all right? I'm still here though. Hey, what's going on, everybody? So it is early morning Sunday. This will be my last day with these, so, and you know, a little over 30 hours I should have these taken out. I'm so excited. Like, they're so annoying. So far so good. You know, I'm not really able to sleep. I'm up, it's about 3:30 in the morning, trying to sleep. I'm really in and out of sleep from the pain pills. I'm like in and out. My nose feels super stuffy. I can breathe through it a little bit still. Not too good, but still better than nothing. And that's pretty much how it's been. I've been lucky to be able to breathe this entire time, pretty much. Only at certain moments I wasn't able to breathe. But I just did a rinse. You know, I'm moving through it. Day 4 is going pretty well. Well, day 3 went pretty good going into day 4. Like I said, it's about 3 or 4 in the morning. I've been up all night. I haven't really been able to sleep. I've been in and out of sleep. So I'm just up watching UFC stuff. I can't really sleep. So I'll talk to you guys in the morning. Let you know how I feel when I wake up. But this will be the last day that I have these in. I go get these taken out Monday. It is now Sunday morning. I am so excited. So talk to you guys in a minute. We're still here though. We're still here doing good, moving right along. Well, I am up. Can't sleep, of course. Stents out in 12 hours. Sitting here watching Rocky. I'm breathing a little better now. I woke up out my sleep, like not able to breathe. It just woke me completely up out my sleep. And I'm like, it's just, I'm just ready for this to be over. All right, you guys. So I am on my way to the doctor's office to get these stents removed. That comes stents, please. So it's been a hell of a journey, but the journey is pretty much over for us. Just well, as far as the stents. We'll see how it goes. I don't know if he's going to let me record it or not. I'm definitely going to ask. But, you know, I'm a little nervous, of course, because what if I don't breathe at all? I know just my brain just thinks like that, you guys. But he's been an awesome doctor up to this point, and I've gotten through some of the worst, so we'll just see. So when I come back, hopefully we'll be in the doctor's office getting the splits removed, because we're almost there, probably 15 minutes away. All right, you guys, I am inside the room, and I don't know what the heck he think he gonna be doing with these tools. Doc, you're not sticking it in my nose, Doc. It's just not happening, Doc. I don't know what you're doing.
Show the suction?
Yeah, you're gonna be suctioning my nose with this. It's all good. So we'll see. You know, I'm about to get the stents removed. We'll see about this glorious breaths I've never had before. All right, so I'm gonna ask him if he's gonna let me film. We'll see. All right, you guys. Stents removal. here we go. It's all good, Doc. Do your thing.
There's that. All right. A little pressure as this comes out. It won't be bad. Take a look.
I'll wait till it's all over.
All right, I'm good with that too. Same thing here.
It's not bad.
Okay.
Take a look.
All right.
That's what was in my
spray
nose?
Yep. Sniff. Pull
Can you
that.
keep them? Can you?
Right
Yeah.
there.
Okay.
All right. Now
Here we go.
Relax.
turn towards me.
Okay,
Tilt down.
this is where my nerves
Relax.
come in.
I get it.
It's okay.
And I'll talk you through it as I go. And I don't know how far I'll go back. Let's see how you react. But it does help getting as much junk out of there as I can. Alright, that's all I'm going to do right there.
If you need to go further back, Doc, just don't worry about me. Just
I
do
see,
your
I
thing.
just want to make sure I can get back there without hurting you. Boy, you did awesome. That's it.
I'm for you.
You did really good.
Oh my God.
Pretty good, huh?
It'll get better.
It's just going to get better, isn't it?
It's gonna get better. So for about 8 weeks, like I said, especially on that left side, you're gonna build up some hard scabs over there. The more you're working the spray, so I'm gonna give you a thick antibiotic ointment that'll go into solution in a spray. So you spray that in there, that ointment will sneak in behind those scabs and kind of help you take those off, okay?
So this isn't the final product.
Not at all. But you're pretty good?
As good as it's going to get.
Yeah, I mean, is it the same on both sides right now? Left side, yeah, so that big scab on there.
It's a little congestion there. It's some congestion.
Yeah. So,
Is it possible they can close up on me again?
No.
Okay.
It's gonna get better from here. It won't get
So
worse.
this is,
okay?
okay.
It should get better.
So this is the
not
bare
worse.
minimum.
That's the bare minimum. All right. So work the sprays. Blow your nose all you want. Okay. 100% back to normal. No restrictions on what you do. Okay. So any exercise, whatever you need to do. Okay. All right. Any questions?
How far did you just go back? You could have went back more. I think I could take
Yeah.
it.
Well, I was all the way back.
You was?
I went all the way back.
Did I shock you? Did I took you?
No, you did pretty good.
Doc, you would have
The answer is
imagined.
yes. You should.
Like I did so good through this whole, and a big part of it was you. You know,
I appreciate
you.
that.
You really were real patient with me, and like I said, I vlogged this whole experience.
I appreciate it.
Um,
Who's your PCP?
I forgot his name. I can't think right now, Doc. I'm
Tell
sorry.
them. That's what helps me the most is if they start sending patients over.
All
So-
right now, I understand that.
But yeah, I can breathe.
All right, so I'm going to see you back in about 8 weeks. Any problems, let me know.
Okay.
100% back to normal. You can blow your nose. You know, it's going to be normal as those scabs fall off, tinge of blood here or there. If you get any
Thank you.
significant bleeding, of course, call me right away. Okay?
So how did it look when you were? How much air do you think I was getting when you started?
Well, I mean, it's hard to tell because it's such a dynamic thing. A lot of your problem was that collapsing, right? So unless there's high-level testing you can do, you know, like the airplane people do,
Okay.
check
If
turbulence.
you were
all
taking
that
an
stuff.
estimate, where do you think I could be possibly?
Yeah, I mean, I don't know. You'll tell me in 8 weeks.
Okay.
After this heals, you'll tell me a lot more. But don't be surprised if it gets a little worse as the next 3, 4, or 5
Yeah.
weeks goes, and then it'll start getting better and better. Okay.
So it could close up on a little bit, not
A little bit
From swelling,
from scabs.
scab.
So the more you're working those, the better. And sometimes I gotta have you come back in here to clean things up. Right now, that scab's stuck so hard there, you don't want me to play with it because it wouldn't feel good. But
If you could take it out, just take it
oh,
out.
I can't. It's too hard. It's too stuck. It would not be good. But say 3, 4, 5 weeks from now, that's going to be looser, and I'll be able to clean that out a little bit
Okay.
better.
Okay,
Alright?
so next time I come for another cleaning, pretty much.
For sure.
Oh,
Okay.
I handled
So-
that pretty good.
So,
Thanks,
but
Doc.
You are amazing,
You did
man.
awesome.
so the
Thank you.
solution for his nose would be
gonna-
prescription.
Hey, can you tell my people what your name is again?
Dr. Rizzo.
Dr. Rizzo. Oh, can I
Thank
take
you.
a picture. I just want to.
All right, no problem. Yeah, no problem.
Yeah, take a picture of me and Doc, man. I was so afraid, Doc. Don't laugh at my crank phone.
Oh,